what are the various forms of the alpha thalassemia syndromes. So, one is the alpha thalassemia trait. So, in this particular alpha thalassemia trait, you have the various forms. You can just see here, that is, in one particular chromosome, only one alpha globin chain is lost, that is dash alpha, alpha, alpha. Then in two respective chromosomes, one alpha globin chain is lost, so thereby there are only two alpha globin chains. And the third one, or the third variant, if you see, in one particular chromosome, you don't have the alpha chains, but you have the normal alpha on the other chromosome. Then we have what is called the alpha T. Now, what do you understand by this word alpha T is, it is non-gene deletion alpha thalassemia. So, alpha T, it stands for non-gene deletion alpha thalassemia. Right? Non-gene deletion alpha thalassemia, that is what is called alpha T. Now, if you see or if you observe, the hemoglobin level, that is around 120 to 150 grams per deciliter is the hemoglobin level in the alpha thalassemia trait. And MCV is reduced where it is around 65 to 80. Right? Now, this particular alpha thalassemia trait, it is mainly because of, right? It is mainly because of one deleted alpha gene. Right? It is mainly because of one deleted alpha gene. So, this we call it as the alpha plus thalassemia. Like basically it's a trait. And these patients, they don't have the severe clinical manifestations. Right? They are asymptomatic or they have mild features. Okay? That is about the alpha thalassemia trait. Then, next you take the hemoglobin H disease. In case of the hemoglobin H, it is slightly severe than compared to that of the trait. In hemoglobin H, you can just see 3 alpha globin chains are lost, left with only 1 alpha. And the hemoglobin is around 50 to 120 grams per deciliter and MCV is around 60 to 70. Right? And these patients with the HbH disease, they have mild to moderate form of the anemia. Whereas in trait, they are asymptomatic or mild. Whereas here, mild to moderate anemia depending upon the genotype. Okay. So, this is what is your HbH disease. Then, so the next one is the hemoglobin Bart hydrops fetalis. So here, you don't have any alpha chains at all. What you have is completely the gamma 4. Right? So, now if you observe the clinical manifestations in these individuals, these fetus, they are the rare survivors. The hemoglobin Bart hydrops fetalis fetus. So, fetal, right? Fetal in utero or at birth with rare survivors. Right? Fetal in utero or at birth rare survivors. Right? And this particular hydrops can also result from the combination of this particular hydrops, it also results from the combination of the gene deletion combination of the gene deletion and non-gene deletion alpha thalassemia. Right? Non-gene deletion alpha thalassemia. So this is what is your hemoglobin Bart hydrops fetalis. Right? So that is the 3 forms: trait, then HbH, and the next one is the hemoglobin Bart hydrops fetalis. Then certain rare forms that includes alpha thalassemia or intellectual disability syndromes, that is ATR16 or ATR6. So here you have the abnormality on the nucleotide ATR on chromosome 16, right? Or over the X-linked gene. So here, like, what exactly is the problem? The ATR16, right? ATR16 is large deletions right? Large deletions and rearrangement. Right? Large deletions and rearrangement on chromosome number 16. That will result in the ATR16, right? And the ATR6, right? Sorry, ATRX, if you see, no alpha globin gene deletion or mutation. It is ATRX chromosome mutation, which is X-linked. Right? So this is one of the rare form of the alpha thalassemia. And the next one is alpha thalassemia MDS, that is myelodysplasia, right? Where you have the 4 alpha chains. And where exactly is the mutation here? The mutation is in, right? The mutation is in the ATRX, right? That is X-linked, okay? So here, this is slightly male preponderance because males have only one X chromosome, slightly male preponderance, right? And hematological findings of the HBH disease is what you will observe in this. Right? The hematological findings of the HBH disease are observed in case of the alpha thalassemia, right? Observed in alpha thalassemia with myelodysplasia. So that is about the alpha thalassemias. So this is, right? So we have the alpha thalassemia trait, HBH disease, hemoglobin BAT or hydrops fetalis, then alpha thalassemia or intellectual disability syndromes, that is ATR16 or ATR6, and the other one is the alpha thalassemia with myelodysplasia, right? Now, if you take the pathophysiology of the alpha thalassemia, there is reduced accumulation of the alpha globin chains. That leaves, right? That leaves non-alpha globin, right? That leaves non-alpha globins unpaired. Right? That leaves non-alpha globins unpaired and unable to participate in the formation of the functional hemoglobin. Right? Unable to participate in the formation of functional hemoglobin tetramers. Right? So that is the problem. So you don't have the alpha. What is that you have is non-alpha globins which have been accumulated, but they are unpaired. So they are unable to participate in the formation of the functional hemoglobin tetramer. Now, in fetus, what will be the change? In adult, what is that being formed? I'll discuss. So in fetus, there is absent or reduced synthesis of the alpha globin chain that allows, right? So there is reduced or absent alpha globin, right? That allows unpaired gamma globin chains right? That allows unpaired gamma globin chains to get accumulated, right? Which are usually the part of the fetal hemoglobin tetramer. Which are usually the part of the fetal hemoglobin tetramer, right? So this is what is nothing but, as just discussed, it is gamma 4 or the hemoglobin BAT. Right, the hemoglobin BATs. Okay, that is in the fetus. Now, if you observe in the adult, right, when gamma globin synthesis is mostly silenced, in adults, like you don't have the gamma globin synthesis is mostly silenced. So what is that you have in adults is, right, so you have unpaired beta globin chains. Right, you have unpaired beta globin chains, lacking a suitable partner to form the adult hemoglobin. Okay, so this unpaired beta globin, they will tetramerize as beta 4. Right, they will tetramerize as beta 4 or the HBH. Right, or the HBH. Okay, so that is what is in the adults. And both BAT and as well as the HBH, they have very high oxygen affinity. Right?